Hello, this is Dr. Gay from First Lake MRI. And this is a 25-year-old male who has had prior ankle surgery. Apparently he had a fracture of his knee and the peroneal nerve was damaged, paralyzed, and he was unable to extend. And so the surgeon repositioned his posterior tibial tendon. And so an interesting case. I've not seen one of these before, but he had an excellent surgeon here. He'd injured himself recently and has some subcutaneous edema, soft tissue injury, but there was no tear of the underlying structure, so that was good. But this is just a look at the interesting anatomy. So since he was unable to extend his leg, the surgeon took his posterior tibial tendon, which should be right here, and repositioned it up front. So on the medial side, we have the flexor hallucis, flexor digitorum, and we're missing the posterior tibial tendon. And the flexor digitorum tendon here comes down, and it attaches to the navicular bone. Here's a navicular bone. There's a little anchor, so the flexor digitorum tendon holds up the plantar arch, and it does the job of the posterior tibial tendon. And here's the flexor hallucis. Now the anterior tibial tendon is this, right up here at front. So we start pretty high up here. Here's the posterior tibial tendon. Normally it comes around this direction, but instead the surgeon took it and moved it around here, around the lateral side. Now it comes down, 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 and it comes straight here. You can see the the extensor hallucis going over the top of it right there. Here's the posterior tibial tendon, and it attaches to the middle cuneiform bone here, and there's an anchor. So now the patient has learned to use this muscle to extend the foot rather than flex the foot. So very interesting. So luckily all the tendons are intact, and this has just been repositioned to act as an extensor tendon so you can dorsiflex the foot. And that's it. Thank you very much.